Welcome to another episode of the Green Room, and we're a little bit revved up this morning.
I am.
We
are. It was me.
I don't know.
You may have been revved up.
I wasn't that revved up, but you were really revved up. So let's start.
Listen, we have our guest on with us too, who's Graham Sorkin, coming from Colorado, and we'll introduce him better when we get around
after
the
we
cannabis
get over
side.
our typical rant.
But I told him, add in anything that you want from on the other side of the mountains or right at the mountains perspective. Listen, I got my paper this morning. So on the front page of the Sarasota Herald Tribune, Sarasota teacher 51 dies of COVID-19. Okay. And Ruta, as you know, we're sick of it at this point. And listen, I had the analogy this morning, and I think it really makes sense to me at this point. Those that are not vaccinated are literally playing Russian roulette.
They are with
right?
their life and their families and their loved ones' lives.
There may be 100 chambers in the gun, so to speak, or whatever odds you want to make it. So it's not a 6-chambered, right, or whatever. But if you're spinning those reels,
eventually something's going to hit.
And there's a vaccine that everybody listen. This is Dr. Barry speaking now. Friend, okay, neighbor, doctor, emergency doctor, all these years, flu shots every year, took the Moderna, happy I did, can't wait for the booster, okay? I'm going to join in with those Palm Beach doctors that spoke as your neighborhood doctor. This vaccine is safe. It's effective, okay? Is there a story here, a story there? I had a patient yesterday literally tell me, Ruta, that he did not get the vaccine because his best friend up in New Jersey got the second shot of Moderna and 7 days later died of a heart attack, which he attributed to the vaccine, seriously, because it was heart inflammation or this or that. But listen, I put my seatbelt on when I get in the car too. And you know, unfortunately, I can be wiped out on 75 by somebody going the wrong way any day. But I'm not going to play Russian roulette. And I'm not going to play it with a 100-chambered gun, or I'm not going to play it with a 6-chambered gun.
No, absolutely not. And, you know, and even
and now it's affecting all of us again. We got our masks.
We're back. But and then also in that same Herald Tribune paper this morning, we have Christian Ziegler's wife, Bridget, who sits on the school board, who's running the Liberty Moms for Liberty caucus here in the local chapter.
So
here.
What does that mean?
Okay,
Moms for Liberty.
They don't want anybody to infringe on supposedly parental rights of having their children not wear masks in the schools. So here you have the teacher who just died, and here we have the school board representative stating they don't want their children masked. So I don't know.
As a neurosurgeon now, I mean, what can they protest that they don't want to wear a mask? That's right. That's right, Adam. Thank you so much for the green screen. You know, we got it. Yeah, it is a green screen thing.
But anyways, at this point, honestly, and you know, I still have people and friends that aren't, and then they get a sniffle and all of a sudden they're like, oh my God, I hope it's not COVID. I should have got my shot. Why does it take you to that degree that you have to wait for you to get some kind of a symptom for you to be like, oh my God, now what? Or that you get COVID and now, oh, I have so many friends posting, I have COVID, I'm in the hospital, pray for me. Well, you know what? I'm sorry. At this point, you're a dumbass and you deserve it. I hate to say that, and it's blunt, but you know what? What goes around comes around. If you're that stupid at this point, so be it. I can't take it anymore. It's like you have something to prevent all of us from getting it. We need that herd immunity. And I'm sorry, compassion goes out the door. It's already a year and a half into COVID. At this point, we have a solution. And if they're not accepting it, so be it. And that's their fate. And I am sorry to say that to the families who lost family members, but
it's horrible. These are tragedies. People don't need to be dying, and that's what's decimating the healthcare community right now.
It is that. I'm sorry,
you can only imagine going in and caring for people who literally have made the wrong choice.
It's the wrong choice,
and an uninformed choice, a choice made because information comes out of this, okay, instead of from your family doctor. And instead of from those that you've trusted your entire life. And listen, let me tell you what the craziest thing to me is about all of this, Ruta. Here in Florida too, and Graham, you may not even have known what's going on in Florida. They have Regeneron tents here. They have Regeneron tents here, okay, where you go in, and if you're sick with COVID, you stand in line and you get monoclonal antibody infusion, okay, and then you're discharged from the tent. To who? To where?
To where?
Who's tracking these patients?
And where's the FDA approval on that? That all of these people were shouting out. There is no FDA approval on it. They're like, but I'll do that, but I won't get the
all
vaccine.
of a sudden,
I won't get the Moderna.
Participating in that experiment?
Only in Florida, I swear to God, only in Florida.
I hate to tell you, but the whole country is seeing Florida and Texas and these other countries and just
I know
what's
it's
going
like
on, guys.
It's literally, it's like what
and
is
it's
going
dragging it out
on?
for everybody. You know, we should be moving on from this by now. That was the whole point. We had a couple months of, okay, everyone's vaccinated. We can start to get back to normal. And then, nope, cancel those trips, go back home, put the mask back on.
Absolutely.
And it's because of these folks who just won't follow science.
They just won't.
Science dictates viruses. People need to understand what a virus is. A bacteria can exist on its own. Viruses not so. Viruses need a animal or a human host, right? So that means that they're going to do whatever they need to do to continue to survive. So conspiracy theory says that, oh my God, all these people got the vaccine. That's why it's mutating and the rest of us no, that's what viruses do.
They do mutate.
And that's why we need to really legitimately look at what's gone on in the history of viruses and endemics and plagues. They typically last about 4 years, Ruta. And that's in an era pre-jet travel.
But that's also, yes. And
pre-jet travel and pre-science.
And then they didn't have the technology we have now.
Of course.
We can develop a vaccine within matter of months. I mean, it was unprecedented what they did. They did do it though. And so we didn't.
It's a miracle of science. But there were 20 years. There were 20 years in the making of those vaccines. They didn't occur overnight. It was the technology that existed. So, but that's the point. But you can imagine going into a tent and getting so my point is we need to follow those people because who knows what's going to go on there. So listen, that's my point that way. Everybody, please, and I'm going to end it up this way. It is a Russian roulette thing for those that are not vaccinated. So this is how I've handled it with my friends and family that are still not vaccinated. I have said to them, I said, listen, this is my last shot at you. I'm speaking to you now as doctor, family member, friend. Okay. And I'll never say I told you so if you get sick. I will not. But on the other hand, hang on. I will. On the other hand, I can't come into the ICU and tell you that I love you and I wish you would have made the different choice because they're not going to let me visit you in the ICU.
No, you can't.
Right? And when you get sick with COVID, it happens fast. It happens fast. And that's the scary thing about it.
It was 5 days. She was on a ventilator, I think 5 days on the 6th day, I think.
And once it's got you, it's got you. It's got you. And you know, it's interesting. I gave you yesterday the article about the Pepsid, the famotidine. Yeah, I know it's interesting. So everybody's still looking for new, for different. When this virus gets you, you may not come back. And please, everybody, be safe. We got to keep wearing the mask. I won't hold it up again, Adam. And, I try to learn. I'm well coachable.
So now we move on.
Let's go on.
And now we'll move on to the cannabis space.
Well,
and
for sure.
And even with technology and advancements, even in cannabis. So, Florida is a little bit slow on the go on some things with cannabis, and we don't always have the same products around the country that other states have. So
sometimes we reach out.
We reach out. So today is the first for us because I don't think we've had somebody on, have we, from Colorado?
You know what? We don't. We tend to Florida focus, but when we have experts.
So welcome.
Absolutely.
Thank you. Thanks for having me.
Yeah, Graham Sorkin, please introduce yourself. I know there's a bio on the page, but tell us what you've done and all about yourself in the cannabis space, man.
Cool. Thanks again for having me. So I've been in the space for about eight or so years now. Started out in the medical space in Washington, California. Got on one of the first licenses in Seattle for manufacturing, and my team partnered up with Murray's Medicinals. I know you've got the patches there in Florida. And I jumped in with them and helped spread that team across 7, 8, eventually 11 states that we got the patches into. And it was really interesting to be kind of at that cutting edge of introducing new technology into the cannabis space when everything was brownies, gummies, joints, just the very first vape pens were starting to roll out around that time. So, spent a few years at Mary's kind of helping spread some of that technology, bring a little bit more, medical standardization in products into the space.
And then was pre-legal adult use in Washington State as well?
So I was on the medical side right as it sort of happened. So we had a medical license, then we got one of those first rec licenses in Seattle. So started making some of the first vape pens, 2014. It was actually my birthday in 2014. We sold the first products in Seattle that summer. So helped kind of open that up. And obviously Mary's was based here in Colorado. So I ended up coming out here with that team. Then I jumped over to Evolab, which was doing some really cool stuff with CO2 extraction, vape pens, terpene extraction. And that actually, we helped get that acquired by Harvest in 2018. So Harvest Health and Recreation. I know you've got a number of dispensaries down there with Harvest. So we got rolled up by Harvest and kind of took over the product manufacturing and strategy to help them. You know, they went public actually that same day that they acquired us, and also acquired SFN San Velasco right at that same time. And so we really started rolling out new products.
Yeah. 1 second.
Well, that's okay. Listen,
are we still rolling? We are.
There we are.
We had technical issues. We're back.
Oh, no worries. Yeah, so, you know, started rolling out some of the Colorado technology that had been in process for the better part of a decade to a lot of these other newer markets that were opening up. So Harvest was getting into Florida. They had a great presence in Arizona. That's where they were headquartered. And starting to open up Maryland, Pennsylvania, into Nevada, California. So building out the manufacturing, the product strategy to take, you know, to help take the products to the next level was kind of one of the things I'm more proud of in my career over the last couple of years, introducing new cannabinoids. So,
how difficult was it navigating it through the different states, Graham? Because as you know, each state has its own, you know, stupid little rules, you know, like we see it around here. No, I'm teasing, but I'm not. I mean, the point is each state rolls out their own programs because of the lack of any federal, you know, oversight or regulation. So I know the answer already, but explain to me how difficult that was in negotiating.
I gotta say, you guys in Florida, I did not make any friends at OMU. So one of the more difficult programs we worked with, and, you know, sometimes it was just like throwing things into a black hole, you know, submitting all the products. You know, we had all of the SOPs, we had all of the test results, we had everything in place. It would still sometimes take 6 months or more to get a product approved that was a very straightforward product. So definitely some unique challenges. And then things, gonna just again pick on Florida because that's where you guys are. Some of the regulations, you know, coming from the right intention, I'd say, trying to protect patients and be very thorough. But then there were some extra bits and pieces that were just, you know, like with the edibles regulations when they first rolled out, no colors allowed. So we had, you know, great gummy SOPs and products that we're using in other states. And we said, okay, well, now we need to, you know, we don't want a
still the way it is
brown colored gummy, so let's find a workaround for that.
Yep.
So yeah, definitely some just unique challenges in every state. You know, Pennsylvania is also kind of a pain. They've got some interesting regulations. So every market's different. Then you get the ones that are, you know, Arizona especially, it's kind of the Wild West. You kind of do whatever you want. You know, we were setting our own standards for quality and best practices and saying, well, they don't require a universal symbol. We're still going to put it on there because we think we should. They don't require test results at that point. We're still going to test and put them out there because it's the right thing to do. So, you know, it's sort of on the companies to create that standardization and implement those best practices for products. Because sometimes the state doesn't require it. And, you know, I started out in California in the early days where it was really the Wild West. And I mean, Washington, pre-rec use, pre-adult use, it was, you know, just those farmers markets, which was fantastic as a consumer, but there was no testing, there was no standardization, really no safety. So it's been good to kind of see that come as the market's matured over the past few years.
So does the rec market, and you have to excuse my ignorance because I'm not as well versed on all things cannabis, I think, as Dr. Berry is, but say for the markets, like you were talking about safety because it's something that concerns me for all products, and every consumer should be always worried no matter what the product is, cannabis or not. Is there more stringent rulings or less stringent when a state goes rec? Like, do they care as much as it for it being like a medicinal grade cannabis and medicinal grade products if it goes rec?
Great question. What I've seen in a lot of markets is it's kind of the opportunity to move from the Wild West medical market to a more regulated market. So Washington, for example, just didn't have a lot of regulations around the medical market. It was sort of the caregiver model. Anybody and their mother could get a license, could produce wherever they want. When the rec market opened up, there was a ton more regulation, and it was down to air quality standards and things like that. And they were looking at every element of the operation that wasn't happening on the medical side.
Oh,
so kind of opposite of what you'd expect.
Yeah.
But I think it's also just kind of moving from that legacy, you know, in California, Prop 215 has been around for, or was around, sorry, no longer is, for, you know, 20 some odd years before the rec market opened up. So when it was first implemented, it was very loose. It was just, yes, you're allowed to use medical cannabis. Here's a couple of very basic standards around it, what it takes to be a registered caregiver or patient, and then just go wild, grow in your backyard, share with your neighbors who are also licensed.
Come right back like it did last time.
So yeah, then rec was kind of the opportunity.
But yeah, you know, listen, yeah, there we are.
Must be a loose connection.
Yeah, it's loose.
Wire.
Yeah, loose screw.
Oh, weird. I'm just talking through.
That's right.
Yeah, good, because we're never sure kind of what streams through and what doesn't. Yeah, you know, it is. It's that standardization that's interesting, and you're right. That's why, you know, as we go forward towards any legal adult use program here in Florida, we try to learn from the experience of Washington State, California, other states that have, you know, in a lot of ways, they've lost the medical program, the medical emphasis. We got to fight to maintain it, labeling, testing. Tax-free status, Graham, is one of the key things here in Florida. You know, one thing that has gone on in every state, and I find this to be an interesting aspect of it, taxation always goes along with regulation, right? So absolutely. We need to make sure that those taxes go to the right place, that legacy players are allowed to participate, that we get minority, you know, and otherwise participation, all the things that won't happen unless we make sure they happen as we go forward. So we try to learn from what's gone on, you know, in other states.
And also that we don't tax these businesses to death. I mean, with 280E and, you know, really the double taxation, it's very hard to compete for a lot of smaller businesses that don't have those teams of lawyers and accountants to kind of game the system more or less. So, you know, I think that overtaxation is why the black and gray markets are still very competitive in a lot of places.
Let's talk products, Graham, and different cannabinoids, and for sure. And listen, I'm really interested in your take on Delta 8, right? And some of the other, you know, Delta 6, 10, this and that, how they may creep into the market or not. Also, of course, the minor cannabinoids, much more importantly, the CBC, the CBG, the CBN, and how you've seen that progress over the 8 years, you know, that you've been, you know, in the zone. I would suspect that's really been an eye-opening thing for you just from the botany side as well, yes?
Absolutely. It's been one of my favorite parts of watching the market evolve, because at Mary's Medicinals, we introduced the first CBC, CBN, and THCA products that were commercially available. So back in 2014, 2015, people were barely starting to talk about CBD. So when I'd say CBN, you know, nobody even knows what you're talking about. And I think it's been really interesting to see the market kind of catch up with that. Now folks are starting to just now in 2021, you know, understand what CBN is good for as sort of the sleepy cannabinoid, helping with all sorts of insomnia, which is a huge market opportunity. There are, you know, sleep disorders affect something like a third or more of Americans. So, you know, where we've been able to introduce them and educate the market, CBN has been huge. Delta 8's another one that, you know, taking a step back, I always found it fascinating to have the opportunity to introduce these new cannabinoids, new mechanisms of action to folks that were only used to THC. So, you know, I was in Washington, I saw the first Delta 8 product. This was probably 2016 or so. And I went to my team in Colorado and said, you know, hey, can we do this? And working with an awesome chemist, Dr. Noel Palmer, he was the chief scientist for Mary's Medicinals and Evolab and Harvest. And he said, yeah, sure. And he texted me the next morning, just a picture that he made in his lab, said, does this look like what you saw in Washington? I said, yep. So we introduced it in Colorado about 2 months later, just rolled it out. And at that point, there was so little data on the effects really of Delta 8. So we kind of introduced
there still is, Graham. Yeah, there still is.
We
all need more research. We all want more research.
Yeah. So I said, how are we going to market this? Because people want to know what it does. Is this different from CBD and Delta 9 and all these others? So our campaign was, we got this new thing. Try it. Give us feedback. And we started with a pilot program. We just launched it in Livewell, one of the bigger chains here in Colorado, and said, we gave postcards with it and said, fill out a survey. Tell us what this is doing for you. Tell us, what the effects are for you, what it's helping you with. And I thought,
where is that data? Where is that data, Graham? Does that still exist?
Yeah, it's got to still exist somewhere. And this was, a very small pilot. I mean, I think we probably got 100, 200 responses. And it just kind of helped us craft our marketing too of, okay, this is, folks are saying it's a little bit more buzzy, a little bit less anxious than, traditional Delta 9. And so we kind of worked that into our marketing. And that was how we helped educate people on what this other cannabinoid is doing for folks.
The reason I ask, the reason I ask is that there today is a town hall meeting put on by the Department of Agriculture. Holly Bell will be leading it. Dr. Greg Gerdman will be speaking at it. And they're talking about Delta 8 literally and figuratively here in Florida because, it's exploded in the gray market and it's still, not regulated at all. So you literally don't know if there's byproducts or any solvents or how much Delta 8 is there. Most of the Delta 8 that people are getting in Florida actually contains Delta 9 over the 0.3%, no doubt about it. Be that in a sprayed on product onto a hemp, joint, quote unquote, sold in a smoke shop or in gummies. Also, let me ask you this because you're the product creator. So I've noticed also that Delta 9 products are being sold in gummies with a small, that once again, percentage less than 0.3% by weight of THC. But actually, if you look at the milligrams of THC that they can put into that type of gummy, Ruta, it can be what? Sometimes 5 milligrams or so, right,
Really?
Graham?
Yeah.
By weight? Is that how people are getting away with it?
People are gaming the system and trying to, it's such a gray area, just like the Delta 8. I never thought when we launched Delta 8, because we were producing it from Delta 9. It was a process in our lab. We weren't starting with CBD like a lot of folks are today. And so even Colorado has banned Delta 8 from hemp. And Evolab, we said, well, that's not how we're doing it. So I honestly haven't followed up with them in the last little bit. I think that product's still out there, but it's such a gray area and there's so many people just kind of fudging the system.
Well, for sure. And now we see THCO acetate, right? Mm-hmm. Which is a product that you make from the Delta 8 by a dangerous anhydrous nitrous process or whatever they actually blow up. So when I read the Leafly article, I sent it over to Adam. My Facebook post started with, do not do this, you're right, no DIY. But the point is, it's actually apparently, and we'll see what the research shows, 3 times stronger than Delta 9 itself. So to me, that puts a different face on things because if Delta 8 is weaker in effect, psychoactivity, if you have a 3 times stronger THCOA, that actually can open up another Pandora's box, so we need to be very cautious as we go forward. I want to make sure that we get a couple words from you about the different delivery systems, patches and creams, the innovations that you've taken from pharma to allow for slow, steady delivery. And some advice, quite frankly, Graham, where are the best places to put patches perhaps? And do the creams work more in different areas, or just go into that a little bit? Because I know you've been really into the development of all that type of stuff.
Absolutely. Thank you. So, we'd always said for patches, a venous area. So wrist, ankle, even side of the neck is where it's going to absorb best, where it's going to be, the skin is thin and it can get straight into your cardiovascular system and absorb quickly. And that's really the benefit of patches, transdermals, is that you're able to bypass first pass metabolism. You don't lose 50-60% of the active material to your digestive system. You can get it straight into
80%
your
of CBD in the liver. Yeah, yep. For sure.
So It's, much more effective. And I think the other benefit there is exactly what you're getting, because different folks have different metabolisms. If I eat a 10 milligram gummy, my system's going to process it a little bit differently than your system. But if I put a 10 milligram patch on, that's going straight into my bloodstream, and I'm going to get the same efficacy, the same bioavailability as most other folks. Obviously, there's a little bit of variability, but a lot less than something like eating a gummy. So that's really one of the main benefits of transdermal. And
two others, if I can just get in, because then I want to go to the next route. One would be, if you don't like a patch, you can take it off.
Absolutely.
Right? And then, so we explain that to our new patients all the time. The second thing that I love about a patch, especially when you get into the anti-inflammatory and the autoimmune benefits of CBD and your other minor cannabinoids, is that consistency of everyday delivery, right? And to me, if you really want to get that medicinal benefit of that consistency of all your, cannabinoids for the entourage effect, that's a great way to do it. So.
Absolutely. Well said. That's a great point. You can't uneat a gummy. Well, you kind of can, but if you're got a patch on and you want to slow down that effect,
it's all
take it off. And
right. So and how about the creams and everything? Do you feel that they work more in a local fashion on thumbs and knees and shoulders? Is that what you found in the preparations for those things as well?
Two things there. There's a lot of just topicals that, aren't going to have that same transdermal effect. That sure, I've heard tons of great data points about, it helps my knee, it helps my shoulder, whatnot. I've definitely used plenty of CBD and THC topicals for that. But when we're talking about something like the Mary's transdermal gel pen, where it's actually a full transdermal gel, then it is a different effect, where it is actually pushing through all layers of the skin as opposed to a topical. So there's an important differentiation there between a topical gel and a transdermal gel that will actually be the same as a patch going into the bloodstream. And one of the things I always loved about the Mary's gel pens was that you can mix and match. You've got a CBN gel pen and THC gel pen, an indica, and you can do, 2 milligrams of this and 4 milligrams of this to kind of customize exactly what you're looking for there. A lot more than a lot of other products, especially in the earlier days when there weren't those sort of low dose options that you could mix and match that same way.
Yeah. I have a quick question about because one of the things we always hear from patients constantly in the marijuana industry is you hear that there's a lack of consistency in the sense of product availability. So you get a patient used to a product, and then the next thing you know, they go back and that product's no longer there. They can't get it. And from a medicinal side, it's very troublesome because, patients, they're used to their Coumadin, they're used to their Losartan, they can go to CVS, Walmart, Walgreens, wherever, and consistently get it. Where in the marijuana space, there isn't that yet. And coming from say the medicinal side and truly having it as a medicine, it has to have consistency. So are you guys focusing at all on how to kind of curve that? Because it's a problem, because you do hear patients and they're like even Mary's Medicinals. I know that we have patients that love it, and all of a sudden you can't get it, and then it's frustration. So, and again, if you're treating it as a true medicine, which we are, it's very disheartening to tell a patient, well, okay, I know you can't get this, and so are you guys working at all on that? And that's an industry as a whole. I'm asking, not just for your company.
That's absolutely. And to clarify, I'm not actively working for Mary's Medicinals or Harvest at the moment. But as an industry, or as just having had that experience, I would have to blame the regulatory system there. If we were able to open up the licenses and open up the production, there would be a lot less of an issue with that. In states like Colorado, where there's, something like 1,000 licenses, you don't run into those issues of running out of material. Florida, things are very segmented. There's no transfers between MMTCs unless there's an extraordinary circumstance, crop failures or things like that. So if a crop doesn't turn out well, then you don't have material to produce as much as you'd like to produce. And so I think that's ultimately a failure of the regulatory system to allow a little bit more flexibility in sourcing and production and scale, really. It's very, very difficult for these independent producers to keep up consistency when they're faced with these constant regulatory hurdles that don't affect a lot of other types of businesses.
Yeah, we're pending about 12 new licenses here in Florida, actually, Graham. So there's going to be a lot of activity, and actually a statement will be coming out from the Medical Marijuana Advisory Committee, Department of Ag, that I sit on, that we're encouraging the DOH and the OMU or the board, whoever controls it. They say that they're still writing the rules, okay, for the
They
new
actually
life.
just need to take away
No,
the
these
stupid
rules have been
vertical
written.
cell.
They've
I mean,
been
that-
written.
that-
They don't need to be
open
rewritten.
competition.
Open up the licenses.
Open up to competition.
That's
Don't
what the
go
patients
vertical.
deserve.
It
That's what the
is.
patients desire.
It is.
It's
They're
gonna more
expensive.
competition. It's gonna, and the breaking up of the verticals is
Breaking up
something
the
that
verticals is a must.
it is, but we need the licenses that are available. You know, here in Florida, Graham, we get 4 new licenses for every 100,000 new patients. So they're literally 3 cycles behind on that. So literally there are people waiting to get into the space right now. So listen, great to meet you, and I wish you all the best. Can't wait to meet you personally post-COVID at a conference or
absolutely.
Give us a quick,
Please.
give us a quick 30 seconds on what you see happening in the cannabis space, something new, innovative, exciting that's down the pike.
You know, I think it's going to be really interesting over the next couple of years to see if and how. I don't expect full national legalization. Maybe I'm a pessimist, but I think we're going to see more and more standardization and more movement towards at least acknowledging states' rights, which is going to create a lot more stability in the market. And, you know, I think hopefully allow for these larger MSOs to operate more effectively across markets, see more standardization of products. I'd really like for you to be able to get the exact same product in California and Colorado and Florida. And that's something that patients deserve. You know, I talk to a lot of patients who can't travel with their medicine and they can't get what they need when they go to somewhere else, even if it is legal. So that's something that's frustrating, and I hope to see more of over the next few years.
Well, everybody, we're running out of time, so we have to wrap it
Got
up.
patients to
So we
see,
have
man.
patients
Busy
to
day.
see. So thank you, Graham. It was
Stay
awesome
safe
to
and
hear
healthy out there
from
in
you.
Colorado, and everybody here
And
in
everybody
Florida.
get your COVID shots.
Indeed.
And we'll
Wear your
see you
mask.
next week.
Thanks so
Stay
much
safe,
for having me.
everybody.
Great to chat.
Thank you.